Health Watch and a CDC warning about the rising number of walking pneumonia cases in young kids. The number of 2 to 4-year-olds diagnosed after visiting the ER for pneumonia-related illnesses has jumped from 1 to 7% in the last 6 months. This type of illness typically affects school-age kids. CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News, is here. Good morning. How are you doing?
I'm good. Good morning.
All right. So why is it called walking pneumonia as opposed to your typical pneumonia that we're familiar with?
Right. So we call this walking pneumonia because you're generally less sick. So you're walking around. You're not laid up in the hospital bed, right? And so the symptoms are relatively milder than what you might see with other kinds of pneumonia.
And what are these symptoms that we should be looking out for?
Yeah, with walking pneumonia, what we scientifically call mycoplasma pneumonia, it's a kind of bacterial pneumonia. You might see sore throat, chest pain, fever. In younger kids, we do sometimes see vomiting and diarrhea, which are a little bit atypical.
And why the increase in kids?
So what we think has happened is with social distancing during the pandemic, we reduced a lot of things to almost zero, like the flu, RSV, other kinds of infections. And so what we're seeing is now a rebound as these different infections start circulating again. And little kids in particular have not been exposed to these things before. So they're all being exposed all at once. It's not necessarily that each individual case is worse, it's just that they're all being exposed at the same time. And so we're seeing a lot of cases.
It's amazing we're still seeing the effects of COVID in this way. So what should parents do if they notice these symptoms, and how can walking pneumonia be treated?
So I think it's important to understand you cannot diagnose on your own. Even I can't. If you come in with some symptoms of, cough or sore throat or runny nose, whatever it is.
That just seems like a cold.
I can't tell you if that's a cold. I can't tell you if it's walking pneumonia. I can't tell you if it's COVID or the flu. You do need to test. And it really is important to get a test because depending on which it is, COVID, there's Paxlovid. For flu, there's Tamiflu and Xofluza. For walking pneumonia, mycoplasma pneumonia, there's certain antibiotics, but it's not certain, it's certain antibiotics, not all of them. So you do need to know what you're treating.
Gotcha.
Dr. Gounder, thank you very much. Appreciate it.